Hi, class. This is the lecture for chapter 16, all about medical insurance. And this is a really important lesson because you'll be educating patients routinely about their medical insurance. So this is a good lesson. Let's look at the first slide. So we have here understanding the role of health insurance. So health insurance, it's very important that we have health insurance so that we can go and see the doctor. So when we do so, we usually pay a copay to see the doctor, and then our insurance gets billed for the office visit, and we'll get a statement usually in about a month regarding the charges and if we owe anything. And doctors, they evaluate and manage patients. They care for patients in terms of the diagnosis of diseases and disorders that they may have. And doctors usually follow up with patients as needed, depending upon the severity of their disorders. Also, doctors provide preventive services. So it's important every year to go in and get your physical. And at the physical, there's a general physical. You might have to, for us women, get the Well Woman exam where they do the breast exam, the pap smear. And as we get older, right when we turn 50, we got to get a colonoscopy every 10 years. When we turn 40, we have to start getting those mammograms. When we get older, we would get like a DEXA scan. So there's lots of preventative tests to make sure that we're healthy and to try to make sure that we don't have any things wrong with us. For men, during the physical exam, when they turn 50, usually they'll get the prostate examined to make sure that it's a normal size. And like women too, they got to get a colonoscopy at bare minimum every 10 years. And they too can also get a DEXA scan to see how strong their bones are, if they have any osteoporosis. And those are just some of the common preventative tests that you'll see and come across. 2, for your diabetic patients. Your diabetic patients, need to get their eyes checked every year, need to make sure that get their CMP blood done every year to make sure that their kidney and liver function is doing okay. Their hemoglobin A1C needs to be done. We need to try to reverse the diabetes as much as possible. So it just depends on the patient's diagnoses, what preventative services can be done for them. So there's lots of preventative services out there. And with healthcare insurance, right, it's a contract between the policyholder and a third party that reimburses the medical provider or policyholder. So this slide is really, really important. So this is super important. This is what you're going to be communicating to patients. Just know that a subscriber is the same thing as an insured beneficiary. The subscriber is one who pays for the insurance plan. A beneficiary may or may not be the subscriber. It could be the dependent, a child, or a spouse. So it's a little bit different. A deductible with insurance, oftentimes on an insurance plan, you have a deductible. Say it's $1,000. So you as a subscriber have to pay that $1,000 out of pocket before the insurance starts covering you. So that's your deductible. So once you pay it off, you then enter into coinsurance. And once you enter into that, that's when your insurance starts covering you at a certain percentage. It could be 90-10, 80-20, 70-30, just depends on the plan you purchased. So they might cover you at 90%, but then you are still responsible for 10% of the bill. And the coinsurance, that's how you want to explain it to a patient. In terms of the copay, there's always going to be usually, not always, some plans don't have a copay, but usually a copay does exist for you to see the primary care provider, and it tends to be double if you're going in to see a specialist. If you're going in for a nurse visit, like a blood pressure check or to get a flu shot, you don't have to pay a copay. And you don't have to pay a copay when you go in for your annual physical. Exclusions, so these are things that are not covered on your insurance plan, like plastic surgery. Coordination of benefits. So sometimes patients have more than one insurance policy. So you have to figure out, who do we bill first? Who do we bill second? That's coordinating the benefits. And you want to always ask them, who's primary, who's secondary, get their input, but also call the insurance companies to verify it, because oftentimes patients don't know. So that is that concept. And explanation of benefits. So once you go in and see the doctor, the EOB is basically the statement after the visit of what was charged to the insurance company, what they paid the provider, what you owe, if anything, what is written off. That's the EOB. And that's sent to the patient. And the RA is what is sent to the provider so that they can do their accounting in the EMR. So some other terminology that is helpful, we have here pre-authorization. So anything that's expensive needs to be pre-authorized. If the doctor orders an MRI, it's going to need pre-authorization. If the doctor maybe ordered a referral, it might need to be pre-authorized. If the doctor ordered a prescription, it might need pre-authorization. So this is the act of getting approval from the insurance company to obtain some sort of service or supply for or on the patient's behalf. That's pre-authorization. Now, a claim is an insurance claim, right? So if you go in and get services from a provider, they're going to file a claim with your insurance company for reimbursement. And in the outpatient setting, we use a CMS 1500 form to file claims for reimbursement purposes. An assignment of benefits is basically saying that when you file that claim, we're requesting that the insurance company pay us directly and not to give the payment to the patient, that we get the payment directly from the insurance company with the assignment of benefits. So that's some good insurance terminology to make sure you understand, because you will be explaining this to patients. Really important. So let's see here. Types of medical insurance coverage. I'm going to kind of skip over this slide. Here's just a picture of a Blue Cross Blue Shield card. So it's kind of nice. But honestly, when it comes to the different types of insurance plans, I usually see HMOs, which is a health maintenance organization, PPOs, which is a preferred provider organization. Sometimes I see an EPO and POSs. So with all of the insurance, right, you're going to run eligibility in your computer system and make sure that the insurance is eligible before, when you're scheduling that appointment. You have to make sure it's eligible, because otherwise the patient's going to have a billing problem if it's ineligible. So eligibility means that the insurance is active, that it's considered in network with your group. And the one thing that is most concerning is like when a patient has an HMO, right? We take all HMOs, but if they're in an HMO, they have to have a Hoag doctor to belong to our group, because that's the only way that they're in network with us. So that concept, a lot of patients don't understand. So they'll give me their insurance card and it'll say on there like Monarch Medical Group. That doesn't say Hoag. I can't let them be seen. It's going to be a denied claim. So you're going to come across that when you work for a medical group and you take all these HMOs, you have to make sure that the patient is signed up with one of your medical group doctors, with one of your primary care providers, in order to be considered in network, to be seen by your medical group. Super important. And then when it comes to PPOs, you know, as long as it's eligible in the system, you're good to go. I have had it happen one time where someone had an EPO and they got a bill. Like they were not considered in network with us. So if you, like when you run eligibility, it'll say, you know, this insurance is eligible, but it's an EPO. So always have the patient, if you're not sure whether or not you take the insurance, have the patient, it's their responsibility to call their insurance and make sure that they can come to you before they're seen, because otherwise they'll, you know, if they get a bill, they'll get really mad at you. And the other thing too, you want to have them sign the form that you had this conversation with them, and that you discussed this with them, that services rendered might not be considered eligible by your insurance. So we have those forms, so make sure to get that signed by them. So it's really important. So those are the major plans you'll see, is like the HMOs, PPOs, POSs, and the EPOs. Now, POS is kind of a hybrid between an HMO and a PPO. So it has both components. So they can come to you and use you and use their PPO benefits to see you, or maybe their HMO benefits to see you. Just depends on how their plan is structured. So I don't really see problems with their plan. It's mostly like the HMOs and the EPOs, you kind of have to watch out for those. Just make sure, you know, they can be eligible, but just be careful that, you know, with HMOs, they're with your medical group. And then the EPOs, you know, make sure they got to call their insurance and make sure they can come so that they don't get a bill if they're seen by your medical group. So, okay, I'm going to go over this slide. Now, we've talked a little bit about medical terminology, which is really important. We've talked about the different insurance plans, and now we can talk a little bit about Medicare. So Medicare is insurance for seniors, and throughout our working lives, we are constantly paying into Medicare. We get it taken out of every one of our paychecks so that when we turn 65, we'll have Medicare insurance. And traditional Medicare looks like this card. And when Medicare first came out, it just had Part A and B. So Part A is the hospital coverage. The Part B is like all the provider coverage, you know, the ability to see the provider and to be taken care of by a doctor. So that Part A and Part B, those were the benefits given to us. And as time went on, we realized as a country that that was not enough coverage for patients, because as we get older, we tend to develop more health problems. So I'm going to stop it there and probably do one more video just to round out this lecture. So hold that thought about Medicare. Thank you.